Well, how concerned should we be about all of this? And Dr. Browne from Griffin Hospital is on the show now. On a 10 scale, where should we be on the concern level?
You know what? I think we... good morning, by the way.
Hey.
You know what? We need to be concerned. But that concern is on we need to sort of say on the 6 level. I think the problem is that there's several people who are on the 10. This is the viral apocalypse. And there's some at the 1, and, this is a good time to be off and drink and party and be together. I think we need to be concerned, but I think we also need to make sure that we have the data to make smart decisions on caring for our vulnerable populations.
Yeah. Have you been to a supermarket lately?
I have, yes. I have a few interesting pictures of an entire aisle gone of all the toilet paper.
Toilet paper seems like it should be on the list, but not on the top of the list, right?
I would agree with that. I probably wouldn't have been the first thing that I would say you need to be concerned about. I can understand the Purell and the hand hygiene and hand sanitizers. The toilet tissue, I'm a little just surprised about.
Overreacting.
So we have a lot of cases in Connecticut, right?
We do.
So 26 that we know of. And now that testing has been ramped up, we're expecting to see spikes, right?
We are, and I think it's important for us to sort of realize that, over the last 2 weeks, as this virus has been spreading across the world and really across now the U.S. from the West Coast to the East Coast, it's important to realize that we haven't done a lot of tests. There's been a minimal amount of testing that's been done. So it's important for your listeners to realize that we're going to have an increase in the number of people who are positive, because this is the point where we're actually flashing a light on the disease. So you're actually able to see who has it and who doesn't. So the concern is that it is already here, but we really haven't been able to have a test or test enough people to figure out actually how much it is.
Who should be tested? Who should come into the hospital? How do you want us to handle it if we have symptoms? And then what are the symptoms? So
it's very clear from the initial Chinese data and the data in the West Coast that 80+% of the patients who end up getting this virus have mild symptoms. So I think that's really important for everybody to know. So 80+. It's very few that end up getting into that critical phase. What I would recommend is that if you are feeling severe shortness of breath, if you're having, high spiking fevers, if you're struggling at home, that is the time that you really need to come to an emergency department. Otherwise, we at Griffin Hospital and Griffin Health, we're instituting telemedicine and telehealth. So you can contact your primary care doc, you can talk to them, and they can give you advice on sort of the next steps. And there's a lot of things that can have fevers and cough and shortness of breath. We are having a lot of patients that have the flu, so that's still out there. So we're still seeing people with the flu, so making sure we're testing them.
How can you tell the difference between the flu and this?
Unfortunately, you really can't. They have very similar symptoms. It's really fever, cough, shortness of breath. It sounds like some of these have been associated with body aches, both COVID-19 as well as the flu. So it's really difficult to tell unless you do the testing. The testing for the flu is a rapid test, and you can get an answer in 15 minutes.
Wow.
So at Griffin Hospital, what we're going to be doing is we're going to be doing mobile testing. We know our colleagues have also started doing this. So if you end up talking to your physician, the physician says, okay, it sounds like you need to be tested because you have fever, cough, and shortness of breath. But we want to make sure that people stay home with this. We don't want them sort of wandering out. What we'll be establishing this week here is a drive-through. So what will happen is they will get they'll be able to get a script from their physician, basically saying that it meets CDC criteria. The physician says it's fine to get tested. They'll come to our drive-through. We'll bring them in. We'll test them. What we're offering is we're going to be offering both a nasal swab for the flu and for COVID-19. So if someone comes in and we swab them, they end up having the flu, then we can get their answer pretty quickly. If it's COVID-19, right now it's taking 3 to 4 days to come back. So what we'll do is we'll recommend that they stay home, until the results get back.
Okay. But you don't want everyone tested, right? So if I feel sick, just stay home, stay away from people, right? But if
Correct.
I feel sick and feel like I have some breathing issues or I might pass out, then I want to call a doctor.
I would say if you feel very sick, obviously I don't want to say don't go to the ER. That would be, you need to be evaluated. But if you have a cough, fever, you're feeling really unwell, your physician can advise you on the next steps. I do not recommend everybody get tested. And if you don't have symptoms, the likelihood that test is going to be positive is low. So really, you would have to have symptoms.
It was just a few weeks ago we were being told by professionals that, the flu is way worse. It kills 50 to 70,000 people in the U.S. a year.
Say, yeah.
And now we're like, the flu is nothing compared to this, right?
It's interesting. Again, time and history tells in these sort of circumstances.
Yeah.
Interesting enough, the detection of it, going back to my initial comment about how much testing we've done. For the flu, we test everybody who basically has symptoms, and we can do it pretty quick. So it's a pretty reliable and quick test to do. With the COVID-19, right now it's not a quick test. Hopefully we'll be able to get better tests, quicker turnarounds, and go from there. So the data that we're seeing is skewed. So really, the CDC guidelines and even the state guidelines, we're only testing people who are the very sick. So if you're testing only the very sick, it's going to look like it's a very sick disease. We're not testing all the people who have mild symptoms. And so you got to look at it in that way. Now, if you look at the data, the probably the most reliable data is coming out of South Korea, which demonstrates that, and they tested 100,000 people, over 100,000 people.
Wow.
And when they tested them, what they found is that it was probably as infectious as the flu, maybe a little bit less, and has a little bit higher mortality. It is a little bit higher, so you got to remember that. But that's also testing people who are symptomatic or significantly symptomatic. I mean, if someone has a mild fever and a mild cough, they may not go to the medical system, which is probably going to be overwhelmed. So you got to remember that it's likely there. So I think my opinion is, as this is all done and said, you're going to find out there's a lot of people who have actually had it and didn't really have any complications secondary to it. So we're probably going to find it's infectious or a little bit more infectious and probably less deadly than the flu.
So would you just say that this is a bad flu season, like really, really bad, or this is a whole nother deal?
In my opinion, yes, that's what I would say. It's like a very bad flu season.
Okay. Because we're starting to get caught up in a little bit of the hysteria. I know I am.
Yes.
It's hard not to.
It's hard not to. I agree.
So when you look at Italy, and it's so bad over there that if you're 80 or over or have breathing problems, they're not even giving you a bed. They're like, say goodbye to your family.
Yeah, make peace.
And then some experts say we're a week behind Italy. Would you agree with that?
I think I think we would look along the lines of what we've done to prepare. And it's very difficult to say what was done or what was not done. Unfortunately, some countries, when they got this disease early, they probably didn't pay attention to it as well as the U.S. does. So again, we want to be careful about the hype and the ignoring it. You got to be somewhere in the middle of the road, and protecting our vulnerable population is really important. And again, I can't speak of sort of what happened within Italy, but if we're not protecting our 80 and above or our elderly population, I mean, it can go like wildfire into that population with a 15% mortality. So that's quite a bit.
15%.
15%
when you're
80, over 80
or over. Okay, and then so 1% overall, right? We're still at 1%.
It's looking from the South Korean data at less than 1%.
Less than 1%. Okay, and then worst case scenario, how many Americans get this? Like what percentage? But
really tough to say. I could tell you that it looks like it's tracking the So it looks like at least the mortality is tracking what we would expect to see in China. So it said 80-something percent, probably over 81%, are actually going to getting mild symptoms. So it's going to be really hard to say how many people actually get it.
Yeah, so I read,
that's tough to say.
We could have 40 to 70% get it in the United States. And if it's a 1% mortality rate, we're looking at, 1.5 million deaths.
Right.
Right,
that's way more than the flu at 50,000 a year.
Which if you look at, and I could tell you I'm a little skeptical of that number, because if you look at China and you look at the size of the population in China, and you look at sort of what happened there, being the first ones to actually have the virus, the first ones to actually spread it, they had documented 80,000. I mean, let's even double that, say 160,000.
And do we believe those numbers?
I mean, I'd say we throw a double in there, right?
That's
so
good.
throw a doubler in there.
Very good.
Throw a tripler in there. I'm okay with that.
Okay.
I mean, you can increase it quite a bit and say, okay, so of that, how many people have died in in that country or around the world? We're talking about over 5,000. So we're getting up to maybe 6,000 now. So if you look at that, and in China, and again, I can't give you the exact number, but let's say 1.3 billion people. That number doesn't necessarily work. And just in logic, if you go through the logic and look at it. So
however,
I am a little bit skeptical about those numbers. It doesn't mean, so we got to get it between the don't be overhyped about this, but also need to be cautious. I firmly believe that, having a 100-year-old birthday party and inviting every family and friend is probably not a good idea.
Or a wedding, there's a lot of things that are just turned upside down.
Right.
And focusing on the vulnerable population is really important.
I just want to talk about China for one more second, because they handled it differently. They built two big hospitals in 2 weeks.
Yeah.
They were just grabbing people off the streets and throwing them in vans and putting them in quarantine, against their will. I mean, it was way more strict than it is here, right? Would you agree with that or no?
I would agree with that. But even with this, they would have identified it later than we did. So that means the likelihood
I got you.
The likelihood is it would spread out a lot faster than they would be able to quarantine it. At some point, you can take those steps, but at some point they're not going to work.
Now, kids can get it and carry it and give it, but they don't seem to be affected or at risk, right? Like they'll get a cold or they'll get what seems to be like the flu, but they won't. There hasn't been any children dying of this.
That's correct. That's so far. And again, I think there's a good points about that. So the first one is, yes, that is correct. They're getting some sort of mild illness. I think their immune systems are pretty ramped up to deal with most viruses because they're children. So I think you're seeing that. The data is showing 0% in a child less than 9. So that's great, 0% mortality. But it's also important to remember that we're talking about statistics. So when we're talking about statistics, even though we're talking about, when we talk about elderly, it could be as, greater than 80, it could be up to 15%. But you got to remember that it's not 0 for those who are older than 9. Only 9 has actually been a 0. Everyone else, there is a small mortality. It could be, as you go to 9 to 20, you're talking about a 0.1, and it continues to go up. So everybody is essentially vulnerable to any viral infection, and it's just important that we again take the proper precautions. And I heard you guys talking about it. I mean, hand hygiene is probably the most important to break the cycle. I mean, this is a disease that, similar to the flu, it's associated with droplets. So being very close to someone and getting sneezed or coughed on is bad. So that spatial distancing is really important.
Oh, and people are freaked out. We went to a restaurant and we sit down, and Jennifer had one of those. You ever get a sneezing thing?
Of course,
You just sneeze.
Yeah.
You're not sick, but you're just sneezing.
Fit. Yeah, happens.
The second she sits down, we sit down, she starts sneezing, and now everybody in the restaurant's looking at us like,
check, please.
Yeah. All right, so social distancing, wash your hands, don't shake hands, use your head.
Exactly. Don't use your head to touch.
No.
Not
right.
Maybe the elbow,
use
but not
your
a
head
head.
to
No
think.
headbutts.
Right. It's hard to press an elevator button with your elbow.
It really
by
is.
the way.
Yeah.
So, all right, Doc, we appreciate you and Griffin Hospital. Thank you, Dr. Browne.
You're welcome. Thank you for having me on.